In this video, we're going to show the cranial ultrasound-guided technique to injecting the SI joint in horses. This horse is properly sedated with detomidine and butorphanol, and we've got a surgical scrub in the SI region there. This horse was very sore when we palpated his SI joints, and due to the patient history, we elected to inject with Hilltop Bio's product, Regeniflex RT. Regeniflex RT is a shelf-stable room temperature product. It's a bioscaffold matrix containing a bunch of beneficial biological factors that promote healing for structures in tendons and ligaments and muscles, and it works by providing growth factors, exosomes, and cytokines to stimulate the body's natural repair process. You can see it comes packaged real nicely in a box with the product and a bottle of sterile saline to dilute it. This particular horse we injected with corticosteroids several months prior with a great response, but it did not last very long. So we reached for the Hilltop Bio Regeniflex RT this round. We draw up the product sterilely using a 6 cc syringe. We'll draw up 4 cc's of the saline using a sterile technique, and then place that into the product containing the Regeniflex RT. And then we'll gently mix that up. This product dissolves really well. And then once it's dissolved, we'll draw it back up into the syringe. You can see how nicely that product dissolves. We'll draw that up, and that will be for one side of the SI, and the other bottle will be for the other. Where we surgically prepped was about 5 to 7 centimeters off the midline, adjacent to and slightly cranial of the tuber sacrale of the ilium. And from that area with the ultrasound, we'll be able to see the ilium and the transverse process of the 5th lumbar vertebra. I prefer to use a 8-inch, 18-gauge spinal needle for this. Some of the smaller horses you can get by with a 6-inch. Make sure we get all the air out of the syringe. On the screen over there, you can see the ilium, and we're going to try to get the needle to match that angle, which I was just a little off at the first insertion, so you can see me manipulate that to get around it. And you'll see that needle go right down under it. This is the advantage of ultrasound guided. If I was doing that blindly, I probably would have missed the whole area. And we'll repeat the same thing on the other side. It's very important to get plenty of alcohol where your ultrasound probe will be. As you can see, I'm not getting a very good image on the ultrasound, but after a quick wipe with alcohol, you'll see how great that image looks. So always have somebody at the ready with alcohol. Then I'm going to try to match the angle of that ilium You'll see the needle in the top left of the ultrasound screen. We're going to slide right under it and go down to the SI region. Most horses tolerate this procedure very well with the proper sedation.